Good morning, my loves. This is week 2 and pre-med and intro. And pre-med, we kind of flipped the flop. First week, I did your respiratory, I did urinary system. Now we're doing respiratory system, all right? So I hope y'all had a good weekend, safe and everything from everybody and all the storms and all. This is the diagram. The diagram will be on the test and there will be a word bank, okay? Now, some of you are overdrawn on your word bank, so please be careful with the spelling, all right? And as it says at the bottom, this is chapter 12 in your textbook. Now, I know when I sent you the notes, this part came out so light you couldn't see it. So I'm going to go over these definitions and vocabulary with you right now. So pause the video or whatever you have to do, and you can go get your notes and we can go over this. Diaphragm. What it says is it's a muscular partition separating the thoracic from the abdominal cavity. It's a very thin layer, and I'm getting back so I can stand up and show you. It's a very thin layer that goes right here, and it separates your chest from your abdomen. Now, if you've ever had hiccups, that's to blame, the diaphragm. It goes into spasms, all right? But it's real thin, and that's all that it does. It's a muscular partition that separates the abdominal and thoracic cavities. I'm trying to push the chair in. Okay, number 2 is inspiration. That looks nasty. Inspiration means breathing in. I just did an inspiration for you. Cilia are fine hairs located in the in the nasal cavity that filter the stuff we breathe in. If you could see what's in the air, you wouldn't breathe, you'd hold your breath. So we have to have something that filters, and it also warms the air. So there's fine hairs in the nose, and if you look at an old guy, sometimes they have more hair in the nose than they do on their head. They don't trim it. Oh, it's nasty. But anyway, that is cilia. Now, that's not the only place you have cilia. You have cilia that lines your small intestine because it's got to move the food along, all right? Okay, number 4 is esophagus. That is the tube that carries food to your stomach. You have the mouth. You have the throat. Air and food both belong there. After the throat, or pharynx, it divides into 2 tubes. The trachea is going to go to the lungs, and the esophagus is going to carry food to the stomach. Okay? And if you ever had something go down the wrong pipe, that's when it happens. Okay, number 5 is a combining form. Now, if I had just put pharyng without the /o, it would be a foundation or a root word. And if I would have just put the /o, it'd look stupid, but that's the combining vowel. So you put the root and the combining vowel together, it becomes a whole different item. It's a combining form. So pharyngo is the combining form for throat, okay? Laryngo is the larynx or voice box. Pneumo means lung. Spiro means to breathe. Auscultation is number 9. That is listening to sound within the body. And when we get together, when we go to school to practice our checkoffs, I'm going to talk about that after a while. When you do your blood pressure, you're auscultating. You're listening to sounds within the body. Okay, number 10, URI, all in caps, upper respiratory infection. And that is when the patient presents or comes in with a whole bunch of symptoms. So it's all classified together as a URI. Number 11, ortho. Now come on, you all are going to be dental assistants. What doctor straightens your teeth? An orthodontist. So ortho means straight. Naso means nose. Come on. Tonsillo. If you don't get this one, I'm going to have to come to your house and smack you. Means tonsils. Now, freno, I don't know where they get this one from, means diaphragm. I didn't make this one up, I swear, okay? Sinuso. sinus cavities. And your sinus cavities are openings back here. And if you've ever had a sinus infection or sinus headache, you know exactly where the sinuses are. When I was younger, I just thought a headache was a headache. And one day my aunt said, "Oh, I have a sinus headache." And I'm like, "How can you tell the difference?" I was like 7 years old. And when I got older, I got one time, and I said, "This must be what she was talking about," because it was, oh my God. And don't try to bend over because it feels like your face is going to blow off. Okay, wasn't that cute? All right, let's see. We're going to leave number 16. Now put those dashes in front of it because penia is a suffix. You find it at the end of a word, and it means breathing. Cyano is blue, like cyanosis. Pleuro is pleura, which is the outer lining of the lungs. Each of your lungs has an inner and an outer lining, all right? A visceral pleura and a parietal pleura. M-E-M, I put dashes after that because this is a prefix. It means in. And thoraco means chest, just because thoracic means chest, so thoraco means chest. Oxo, come on, don't tell me it's an ox. No, don't do that. Oxo is oxygen. We breathe in oxygen, breathe out carbon dioxide. Rhino. Rhino is nose. You ever think of a rhinoceros and his nose? All right, well, wait a minute. I put two words next to it. I put rhinorrhea and rhinoplasty. Rhinorrhea means a watery discharge or flow. Rhinorrhea is a runny nose. Plasty means surgical repair of. Well, guess what? That's a nose job. Rhinoplasty. Okay? S-O-B. I know. I know y'all are calling me that under your breath. I can hear it. S-O-B is shortness of breath, if you want to get technical. Dyspnea. Now remember we had penia back in number 16, and it was breathing. Dys is difficult or painful. So dyspnea is difficult or painful breathing. Apnea. Now remember we had penia number 16, P-N-E-A. I'm going to give you a little secret. If you put an A or an A-N in front of a term, it means just the opposite. So penia means breathing according to number 16, but apnea means not breathing, okay? Apnea is not breathing. And then I added trachea, T-R-A-C-H-E-A, which means windpipe, which is where the air goes down into the lungs. All right, starting the notes. Starts on page number 3, right here. Look how cute. And I've already highlighted and underlined stuff for you. Respiration is the process of breathing. Now, did you know you have 2 types of respiration? You didn't. Don't tell me you did. You didn't know it. I didn't know it. I thought the heart just pumped blood around too. Don't forget that one. External respiration is exchange of air between the lungs and the external environment. So it's like just breathing the air in, all right? Internal is the exchange of gases within the cells or organs of the body. Once you breathe in, that air doesn't stop. It's got to keep going. It's got to go to your cells. That's internal respiration. You have 2 types. External, come on, think about it. Outside, external environment. Internal is where the air goes to the cells in your organs. The gases that are exchanged during this are oxygen and carbon dioxide. 1 inspiration and 1 exhalation, whatever you want to call it, equals 1 respiration. So breathing in and breathing out is 1 breath. It's not in 1, out 2, because you're going to be counting respirations for a checkoff. Respirations, the average adult breathes about 16 to 24 times per minute. Okay, if you have the book, it's chapter 12, and there's a big diagram on one of the first few pages. That's what I'm going to try and go through. And what I'm also doing here is following the air as it goes through your body. So, first thing you got to do, number 1, Air enters through the nose. Now, the openings in the nose are called nares or nostrils, okay? Now, as air passes through the nasal cavity, which is lined with mucous membranes and that cilia, remember that fine hair that filters and moistens and warms the air? It's going to go to your paranasal sinuses. They also contain cilia, and it lubricates the air, creating a sound, all right? From the nasal cavity, from here, you can feel the air in your throat, all right? Nasal cavity is going to go to your pharynx or throat. Now, there's 3 divisions. These are not on the test. Nasopharynx contains the pharyngeal tonsils and adenoids. You can't see mine because they're gone. The oropharynx contains palatine tonsils. These are the ones we see in the back that fight infection. And laryngopharynx divides into 2 branches. The larynx, which is the voice box, and the esophagus. Now, go back to the letter B, oropharynx. If you have not had your tonsils out, you can go in the bathroom and look in the mirror and go, ah. Now, make sure your tongue stays down. You may need something to help you, keep it down. And when you look in the mirror, if you look on both sides of your throat, not the uvula hanging in the middle, but on both sides, you'll see this cluster. That's lymphatic tissue. That's your tonsils. They're there to fight infection. Now, when I was a kid, and yes, I was a kid, first time you had a sore throat, they yanked them out. Now, thank God, they've learned they're there to fight infection. Now, if you get constant sore throats and the tonsils are the source of the sore throat, yeah, they're going to come out. But they take much longer time now before they just go yanking them out. Okay, number 4 is the epiglottis. And it's already labeled for you on your diagram. Oh, look at that. Number 3 is the epiglottis. And the epiglottis is that flap of cartilage. Okay, you can't see it, but it's a flap of cartilage that closes when you swallow and breathe. All right, it's to keep you from choking, which I'm doing right now. Number 5, so we're back here to the epiglottis. Look at the wrinkles. Ooh. All right, air is now going to travel from the larynx or voice box over the vocal cords, and the air is going to vibrate the vocal cords, giving you the ability to make a sound, all right? Have you ever heard anybody that talks through their nose? I don't tell anybody I did that. I just do it for you because I love you. But don't tell anybody. But really, they can talk through their nose. All right, now your windpipe trachea is about 4.5 inches long, and it's about 1 inch in diameter. About 1 inch, that's it. Okay, number 6. The mediastinum. Media, we're the only city that calls it the neutral ground. Every other city and state calls that divides the street the median. All right, we call it neutral ground. Okay. The mediastinum is located in the mid-chest. Now, this is about right here, and it's where I underlined this for you and highlighted it. It's where the trachea divides into 2 branches called bronchiole, okay? Your bronchial tubes. So here we go. The trachea is right here. Now, it's got to get to the lung, but you can't just send a 1 inch, 4.5 inch long tube into your lungs. No, you got to do it slowly and gracefully. So the trachea is going to branch off into 2 tubes, okay, called bronchial tubes. And this is our bronchus. Now these, yeah, they're bigger than the ones we're going to get to in a minute that are lower, but this is the start of it. Okay, mediastinum. Okay, we have bronchus, which is singular, and bronchi, which is plural. Now each bronchus, let's see if we can show you here. Okay, see it? Let's see. Yeah, there we go. There's your trachea. This is the bronchus that's breaking off into the right and left. Let's see if we can keep this up. Each bronchus leads to a separate lung, either right or left. There's one for each lung. Now, if you notice, the left lung, this is the patient's right side, has 3 lobes or 3 sections. The left lung only has two, and it's a smaller lung. You got any idea or reason thinking why? Maybe because of the position of the heart. Okay, that the left side is a little bit smaller. So the bronchi continued to, number 8, bronchi continued dividing into smaller, finer tubes or branches. Okay, so the bronchi are going to continue to branch off. It started big up here, it's getting smaller. All right, so the bronchi are going to continue to branch off until they become number 9. Number 9 is bronchioles. And if you look at your diagram, the bronchioles are these little bitty tubes going into the lung, all right? The little tubes like that. The bronchioles are small branches that end in the tips of the collection of a bunch of air sacs. So at the end of each bronchiole, there's a cluster of grapes. It looks like a cluster of grapes, but it's real tiny. And so each branch that ends in the tip of collection of air sacs in the lungs, these are called alveoli. Now, can you see how we've gotten smaller and smaller? So we've got the alveoli. Singular, it's alveolus, okay? And they do look like grape-like clusters. Number 10, you have approximately 100 million alveoli in both lungs. So it's gotten smaller and smaller and so thin, all right? Let's see, let's put this down, we don't need this. This is actually where the exchange of gases takes place in your lungs, in the alveoli, okay? Red blood cells in the blood carry oxygen and take carbon dioxide away. Okay, here's a red blood cell. It looks like a lifesaver, but there's no hole in the middle. It's just dented in the middle. And that's so a lot of things can get through your body. Food, protein, nutrients, you name it. Oxygen hitches a ride. Hemoglobin hitches a ride. That's where it goes. And we're going to take the oxygen and drop it off at the cell. And then we're going to pick up the carbon dioxide, which was used on the last round. Every time you breathe in, you get a new set of oxygen, and it's got to be brought. It's got to be brought even to that little gnarly butt pinky toe you have. It needs air too. It needs oxygen to survive. So that's as far as the oxygen's got to go. All right, number 12. Number 13. Each lung is covered, like I told you before, with a double layer. It's called the pleura. It's like a sac. These sacs, now around the lungs, let's see. Okay, here's your lung. This is the pleura right here. And you have an inner pleura, that little darker line, and an outer pleura. Now in this, I'm gonna get back to the notes in a minute. Right in there's a little bit of fluid, and it kind of acts as a shock absorber, all right? Just like we have a little sacs around the heart. So each lung has a double layer of the pleura. The parietal pleura is the outer layer that's nearest to the ribs, okay? The parietal pleura is the outer layer nearest the ribs. The visceral pleura, which is the darker line right there, the visceral pleura is the inner layer that's near the lungs, and that's what actually lines the lungs, all right? Number 14, we talked about this one already, lung. The left lung has 2 lobes. The right lung has 3 lobes. Now, that's lobes, okay? The apex is the uppermost portion of the lung. The base is the lower region of the lung. Now, if you have pneumonia, gravity pulls it down, making it difficult for you to cough it up. So it's so thick and so far down. That's why they'll give you medication to thin the mucus out. Okay, so you've got the apex and the base. The hilum is the midline, okay? The midline, right between the lungs. The diaphragm, there we go. You know, it's not on here, but the diaphragm is right here. We're on number 15. It's that muscular partition separating the thoracic and abdominal cavity. It's actually made like this. And what happens when you breathe in, just like it says, it goes straight. When you breathe out, It goes curved again, all right? That's actually pushing on your lungs to make them move so you can breathe in and out. It relaxes when you breathe out. The chest gets smaller, the lungs get smaller. The diaphragm is going to push on the lungs to push carbon dioxide out. Okay, page 4, disorders. Okay, we got a bunch of them that are underlined, all right? Things that can go wrong. These are around page 473 to 480. Tonsillitis. Now, itis means inflammation of. You can have inflammation of a lot of stuff. You've heard me say that. It is an infection of the tonsils due to bacteria. That's important because it can be cleared up with antibiotics. Where if it was done with a virus, no, you're not going to clear it up with antibiotics. And the reason it doesn't is because a virus can look like this today, and you make medicine to get rid of that, and you take it, and tomorrow it looks like this. It keeps changing, so you can't keep up with it. Okay, just like the cold is the virus. All right, so we did tonsillitis, sinusitis. Now listen to this one. That's an infection of the mucous membrane lining the sinus cavity. It's the same thing as saying inflammation or infection of the sinus cavity, but for the test, we're going to be more specific, and we're going to say that mucous membrane lining the sinus cavity. Epistaxis. All you need to know about that is that it's a nosebleed. Now, what I put in parentheses is it can be caused by HBP, which stands for high blood pressure. It can also be caused by trauma. You hit the nose, allergies. Now, people are always telling people when they have a nosebleed, oh, hold your head back, hold your head back. No, not. That's the worst thing to do, because then they're going to swallow the blood and they're going to regurgitate or vomit. What you want to do is pinch. Look, the bone in your nose stops here. All of this mess is cartilage. Pinch right here, all right? And keep it there. That's what people don't get. They'll pinch for maybe 10 or 15 seconds and say, it's not working. You didn't hold it long enough, all right? So that's what you do for a nosebleed. And I mean, if it's trauma or if it's something like you think hypertension, get them to an emergency room, all right? Asthma. Down here in Louisiana, there is a lot of asthma. In fact, Aaron Neville has it so badly that after Hurricane Katrina hit with all the mold and the mildew and the stuff in the air, he couldn't stay here. He went and lived in Las Vegas for a while just to get away from the bad air. Asthma is a chronic inflammation. What's chronic mean? Chronic, long term, all right? It's a chronic inflammation with airway obstruction due to bronchial edema. Now, all that means is your bronchus are going to swell up. That's edema. Well, if they're supposed to be this big and you breathe and get air through, what happens when they become that little? Because they've swollen up. You're not going to get much air through, all right? Okay, lung disorders. Now, these are actually ones that affect just the lungs. Lung disorders. The first one is atelectasis. Atelectasis is an incomplete expansion of those little grape-like clusters, the little alveoli in the lungs. It's a condition in which what happens is the lungs fail to expand normally. It could be caused by a collapsed lung. It could be caused by pneumonia. It could be caused by injury or a fractured rib. If you break a fractured rib, it can puncture the lung, which means air's not going into the lung, blood and fluid is. So that is atelectasis. Next one is emphysema. I know I put an S on the end. It should be an A. I'm sorry. Emphysema, not emphysema. No. Emphysema is a degenerative disease. Oh, Lord. Degenerative. It's only going to get worse. Now, there's medications, of course, but it's only going to continue to get worse. So, Emphysema, if this cuts off, because I'm going to be getting close to the end, I'll finish it up tomorrow. Emphysema is a degenerative disease marked by the loss of elasticity of the lungs completely and hyperinflation or distension. The alveoli are like rubber bands. Well, in this disease, what happens is the alveoli expand and they don't go back. So they're doing you no good whatsoever. And again, it is a chronic disease, all right, or degenerative as well. Pneumonia is an acute inflammation. Oh, that's just the opposite of chronic. What's acute mean? Short-lived. Doesn't feel like it's short-lived when you got it. Pneumonia is an acute inflammation and infection of the alveoli. You notice everything attacks the alveoli. It always is going to attack the smallest part of a body system because that's the part that does most of the work. Like in your blood, it's the capillaries that do all the work. Well, this one is going to affect the alveoli. These alveoli now fill with pus or products of the inflammatory reaction in the lungs. Now, pneumonia can be viral or bacterial, and it can be fixed or cured with antibiotics if it's bacterial. If it's viral, no, okay? And that's pneumonia. Remember I told you it settles at the bottom of the lung. Ugh. You may hear something, it's not in the notes, but you may see people turn a patient on their stomach and cup their hands, and it's boom, 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 all up and down their back. This is called tapotment. They're giving you medication to loosen the phlegm up, and what this is trying to do is break it up so you can bring it up, okay? But you go along the patient's back, not real hard, just cupping your hands, okay? All right, under lung disorders, the last one, number 4, pleurisy. That's an inflammation of the pleura. Remember that lining around the lung, that little bitty line right here? Well, let me tell you something. With that little fluid in it, you let that get infected, you don't want to breathe. Because every time you take a breath, it's a new adventure in pain. You want to take such little shallow breaths, like, because you really don't want your lungs to move, but that's not good. You've got to get oxygen in, all right? And that's pleurisy. Now, clinical procedures, page 481. The first one is the pulmonary function test. It's abbreviated PFT. And this is a whole bunch of tests. These are tests measuring the ventilation mechanics. In other words, how good does all of your respiratory system work? Of the lungs, airway function, lung volume, how much can your lungs hold? The capacity of the lungs to exchange oxygen with carbon dioxide, okay? Internal and external. Number 2 is thoracentesis. Now look at thora, that means chest. Centesis is a suffix that's found at the end of the word, and that means a surgical puncture. So a thoracentesis is a surgical puncture to remove fluid from the pleural space. Now sometimes you'll see them do have to go, if you ever watch any of these real Lifetime emergency shows, they'll have to go in and put a tube in the lung because you have a collapsed lung. There's no air, it's just filled with blood. And when they put that tube in, blood is going to come gushing out. But then the patient can breathe easier too, all right? Okay, number 3 is tracheostomy. Tracheostomy is a surgical creation of an opening into the trachea through the neck. Now, if you want to feel right here, I know I'm old and I got those things, it's ugly, but if you feel real, not hard, but firm, you'll feel little bitty rings, okay? Little lines, okay? That's cartilage, and that's your trachea that you're feeling. And a tracheostomy has to be done in between those little bits of cartilage, all right? And it's a surgical puncture, creating a surgical opening. Now, the tracheotomy is the actual surgical incision that's necessary to create a tracheostomy. When I was little, I wanted to be Nancy Nurse, and my daddy had thyroid cancer when I was 10, and they had to put a trach in. And he came home from the hospital with the trach, but we had to clean it out. So my mother and I, my sister, didn't want anything to do with it. And so, Nancy Nurse, I'll do it. And I get all my equipment set up. I get my daddy laying in the bed, and it's covered with gauze, gauze and tape to keep it clean. And and my mother kept saying, watch your face, your facial expression. Your daddy has not seen this yet, and it really looked bad. Your daddy has not seen it, so watch your facial expression because it's going to scare him. And so and I take the gauze off, and the minute I did, smoke started coming out of his trachea like crazy. Well, honey, I was a 10-year-old. We lived out here in River Ridge, a block from the levee. I would have broken the speed record going from my house to the levee once I thought I ripped his throat out and made it start smoking. Oh my God, what did I do? And my daddy is laughing. My mother's chasing me down the street to tell me to come back home. What had happened was my daddy had taken a draw on a cigar and held it in until I removed the gauze. And of course, air doesn't come out of here when you have a trachea. It comes in and out of here. It doesn't make it this far. And when he breathed out, that's when the smoke came out. Yeah. I wanted to clean that thing again. Sheesh. All right. Number 5 is chest X-ray, and it's just abbreviated CXR. All right. Just like I put at the bottom, there is a diagram on this test. My advice is to study a little bit each day. Otherwise, you may not succeed if you try to cram the night before. All right. So, also, I have this addendum. I hope I sent it to you all. Like I said, if we get cut off, I'm going to finish this tomorrow. But these are addendum notes. DPT. DPT stands for diphtheria, pertussis, and tetanus. It's an injection with, can't read backwards, which is part of the vaccine series of young children. DPT, all right? Number 2 is LLL, be that way. That is the left lower lobe. We're talking about the lungs here, all right? I can't read up backwards. It's the left lower lobe referring to the lung. Remember, as with the divisions of the abdominal cavity, direction is always first. So you see LLL, it's not lower left lobe, it's left lower lobe. OSA, I can't read backwards. That is obstructive sleep apnea. Now what happens is breathing actually stops while the patient is sleeping. This can lead to narcolepsy, where you fall asleep during the day and you don't know why. A CPAP machine, which is what they put on the face, stands for continuous positive airway pressure. This is used during the night to help the person sleep. Because, if you have sleep apnea, you can actually stop breathing 60 to 70 times per night. Little bitty stops, but that's when they do the sleep studies. They discover how many times a night you stop breathing, all right? And finally, CNS. CNS stands for culture and sensitivity. It is a type of testing. I can't read it. It's a type of testing that's performed. They want to check, they get a sample or a swab, and they put it on a slide, and they want to look at it and see what its culture, will it grow on it like a mold will? They want to see the culture and what it's sensitive to, what type of medications would work on it. All right? So, I can't believe we did that much. That sounds good. Oh, I hope it doesn't cut off. Teachers are going back to school, not today, Monday, because of the storm, but starting tomorrow. Students are not. I'm going to be calling you, like I did twice before, to set up a date for us to go to school to practice and check off on the skills, all right? This month we have pulse, respiration, blood pressure, and CPR. So I'm going to call you because we're going to go to school one day this week. So when I call, please don't ignore the call, all right? Because I can't keep calling people. I have a lot of other things to do. If you'd see my dining room table, it's a banquet size table and it's filled, okay? Ugh, drive me crazy. Anyway, I will be calling you to set up a date and time for us to go, all right? We will be there 4 hours, just like we are for regular class time, because we've got to get these checkoffs done, all right? Okay, loves, I'm going to start calling you on a little bit. Hang in there and I'll be back with intro, which is the CPR notes, all right? Love y'all. Take care.